Good afternoon, and thank you for joining the 18th World Conference on Tobacco or Health webinar series. Today's webinar is titled, Can we Achieve Justice in Health? Lessons from Population Health, Human Rights, and the FCTC Process. Before we get started, I would like to go over a few features that will allow you to take part in today's event. When joining the webinar, you were prompted to set up your audio. By default, the platform selects your computer's mic and speakers. If you prefer joining over the telephone, please select phone call in the audio pane and the dial-in information will be displayed. Please note that you are joining in a listen-only mode, which means that you are muted throughout the webinar. However, during our session, you will have the opportunity to engage with our panelists by submitting your text questions in the questions pane. You may send them at any time during the presentation. We will collect and address these questions during the Q&A segment at the end of our panelists' presentation. Now, without further ado, I am pleased to welcome our webinar moderator, Dr. Adriana Blanco Marquito, who is the head of the Secretariat of the WHO Framework Convention on Tobacco Control since March 2020. She is a medical doctor with a master's degrees in policies to prevent addiction in children and adolescents from the Latin American Center of Human Economy, CLAEH. She actively participated in tobacco control activities in her home country, Uruguay, which contributed to Uruguay becoming the first smoke-free country in the region of the Americas. Before joining the Convention Secretariat, Dr. Blanco worked at the Pan American Health Organization as Tobacco Control Regional Advisor, and later as Chief of the Risk Factors and Nutrition Unit in the Department of Non-Communicable Diseases and Mental Health. Thank you, Dr. Blanco, for joining us, and it's over to you.
Thank you very much, Joanna. This webinar is organized by the Union and the 18th World Conference on Tobacco or Health Scientific and Track Committees. I'm pleased to welcome also the speakers joining me on today's session, Dr. Dudley Tartan and Mrs. Kelsey Romeo Stupai. Well, dear colleagues and friends, I would like to start with some hard facts, and if the colleagues can pass the, okay, thank you. It is not news that tobacco is a threat to health, life, and well-being. In fact, 8 million people around the world die every year, because of tobacco use. What is even more outrageous is that while 7 million of those people die as the result of tobacco use, more than 1 million die as a consequence of somebody else's decision to smoke. A decision often taken at a young age when its impact is not well understood and will have long-lasting effects. Unfortunately, it's a decision that marks the beginning of a lifelong struggle with an addiction, usually with many unsuccessful attempts to escape from it. That brings me to my first point. Tobacco is a human rights issue. It's the right of those children or adolescents caught in a deadly addiction brought on by the marketing of an unscrupulous industry, and the right of those who die of a tobacco-related disease without having smoked a single cigarette, but still fell victim to the second-hand smoke. Beyond its impact on health, we know that tobacco is detrimental to society, the economy, and the environment, and is a big contributor to inequities in health and beyond. Next slide, please. Now, allow me to introduce my second point, that is not everybody pays the same price. Over 80% of the more than 1 billion tobacco users worldwide live in low and middle income countries. There is a strong link between tobacco use and socioeconomic status. The experience in many countries shows that the most vulnerable populations usually consume higher levels of tobacco. And nowadays, unfortunately, the COVID-19 pandemic has further increased and exposed existing inequalities, with COVID-19 and tobacco use created a deadly combination. People living with tobacco-induced non-communicable diseases are at higher risk of COVID-19, and smoking is associated with increased severity of disease and death in COVID-19 patients. For vulnerable populations, the danger is especially acute, as those people generally have less access to prevention and treatment, and they are the ones who usually cannot afford the cost of healthcare. In developing countries, smokers spend up to 30% of their income on tobacco, leaving them with less money for food, education, and healthcare. In addition, farmers growing tobacco are caught in a vicious cycle of poverty and debt because of the industry's unfair pricing practices. Tobacco companies excel at zeroing in kids' desires, societal gender norms, and class stereotypes to generate profits. For decades, they have targeted the young, the poor, and especially women, promoting the image that smoking represents independence, fitness, and modest lifestyle. Next slide, please. Now, let's turn to some better news. We have a solution to the problem, and it's tailored, inclusive, comprehensive, and very cost-effective. The WHO Framework Convention on Tobacco Control, now with 182 parties, is an evidence-based treaty that reaffirms the right of all, and I emphasize all people, to the highest standard of health. Calling for a comprehensive multi-sectoral application of tobacco control measures, the convention proposed tailored protections for those who are the most vulnerable to tobacco. These include price and tax measures to reduce tobacco consumption by various segments of the population, but in particular, young people, as well as ban on tobacco sales to minors. Requests to address gender-specific risks when developing tobacco control strategies. Call for the participation of indigenous people and communities in the development of socially and culturally appropriate tobacco control programs and economically viable alternatives for tobacco workers, growers, and individual sellers to access sustainable livelihoods and enjoy social and economic rights. The WHO FCTC implementation is included in Target 3.8 of the Sustainable Development Goals and contributes to many other goals and targets beyond the SDG 3.4, with call for a 1/3 reduction in premature mortality due to NCDs. If we wish to respect our pledge that no one will be left behind, addressing tobacco-related disparities will be a long-term endeavor, and fully implementing the convention is a good place to start. Finally, please allow me to remind you that the WHO FCTC also is linked to a protocol, the protocol to eliminate illicit trade in tobacco products. That will help protect the gains obtained under the convention by curbing the flow of often cheap, illicit tobacco products. Therefore, I call on parties to the convention that have not already done so to consider becoming a party to the protocol as well. Next slide, and last one, please. Thank you very much. And now, allow me to introduce our next speaker. It's Mr. Dudley Tartan. As program specialist in UNDP's Bureau Policy and Program Support, he focused on health partnerships and covered issues including non-communicable diseases, health governance, the economic determinants of health, and the Sustainable Development Agenda. Dudley supports countries to identify and implement the most effective health policies and in turn grow their economies and achieve the Sustainable Development Goals. Dudley has worked with UNDP and Health and Development since 2004, first at headquarters in New York, then in the UNDP Russian Federation Office, the Bratislava Regional Center, the UNDP Representation Office in Geneva, and now in the UNDP Istanbul Hub. He's going to present Leverage the UN SDGs to reduce poverty and inequities caused by tobacco. The floor is yours, Dudley.
All right, colleagues. I've been muted. So thanks, Adriana, for the kind words, and I'll give a quick rundown of the topic that's quite keen interest for UNDP: this linkage of tobacco control, rights, and justice. Next slide, please. Essentially, we can approach the issue two ways. The way we normally do it is to use rights, law, justice as a tool to advance tobacco control. And that's the sort of one that's easy to point to different activities and publications. And then the other way to look at it, which we'll do after that, is to see how we can embed tobacco control in different movements of rights and justice that are increasingly topical these days. So on the first one, next slide, please. How to use the law and rights and justice as a tool to advance tobacco control. UNDP has been working in several dozens of countries to do what we call legal environment assessments, where we go in, convene a group of policymakers and academics and activists to take a deep scan of the legal environment in a country. Typically, we've done it for HIV, tuberculosis, now we're doing it for COVID. And these two toolkits here are for pilots that we're working on now to begin soon, we hope, to look at how the legal environment for tobacco control, both in terms of the laws on the books, as well as the way that they're implemented, to take a deep view of that. So it's the end result is really a process of getting a clear vision of where tobacco control and law sits within each country. And we'll also do, starting this year, the same thing for non-communicable diseases. Next slide, please. Another area where we approach the work to get to use rights, justice to advance tobacco control is a program of support we have for parliamentarians. So UNDP has an existing program to build the capacity of parliamentarians in maybe 36 countries. And we're linking that with the work we're doing with the FCTC Secretariat on tobacco control, so that we have a really tobacco control specific program of support and capacity development. We're doing that with a tool that's a portal for parliamentarians called Agora. And we've started interviewing some key MPs who have had really good examples of how they've either shepherded through tobacco control to turn a bill into legislation, or how they've been able to implement effectively, essentially the measures recommended or obliged by the FCTC. So those two areas are really how we're using justice to get tobacco control further. And the next one, please. Now we'll look at the other end. So how we can take tobacco control and use other justice movements to strengthen those themselves and to really make tobacco control central to these other movements. The first one, we'll look at the movement for economic justice. Next one, please. With the FCTC Secretariat, we've done a set of investment cases in the FCTC 2030 focus countries. The first, let's see, 14 are here on this slide, and we're about to launch another 9 for a new set of countries. But one thing we've looked into in a little bit of depth in some of these countries is the equity impacts of tobacco control, just to make sure that there's no misconception that tobacco control, or especially raising taxes on tobacco, is regressive. We have the evidence here, and lots of literature backs it up, that tobacco control is progressive. It's a pro-poor policy, and we can have country-specific examples of how to look into that. And I pulled out a couple here. Next slide, please. We'll go through three short ones. This one from Nepal, where it's just a clear income quintile chart of where the deaths averted lie. And this is for tobacco tax increase specifically, as are the next two. And you can see really concentrated in the poorest, especially the poorest quintile, but even in the poorest two. This is really where the averted deaths happen. Next one, please. Next one is from Colombia. It's the same thing, but really looking at where are the avoided catastrophic health expenditures, so the avoided impoverishments. And typically, of course, you know, the people most likely to be impoverished by tobacco-related illnesses are going to be at the lower end of the income spectrum, and that's what we see here with, you know, a big majority the benefits going to the lowest two economic quintiles. Last one, please. Next. And this is from one that we'll launch in the next month or so. This looks in Eswatini at the relative reduction. So if we do increase taxes, where are the reductions in tobacco use prevalence happening? And we can see even in a place where the consumption patterns by income quintile doesn't follow this pattern. So usually we have higher consumption in the lower economic earners. In Eswatini, it's a little bit reverse. It's pretty even, but a little bit reverse. So even where you have more people using tobacco at higher incomes, the benefits still go to the lower income parts of the population. Next, please. So the next one is, how do we embed tobacco control into arguments and movements for health justice? Next one, please. The obvious one. We know the extent to which COVID has changed the entire development agenda, really putting health and certain parts of health, of course, really at the top of the decision makers' tables, at the top of the list. We can see, I don't think there's been anything, certainly in my working career, probably in my lifetime, where a health issue has garnered so much attention and such a high priority. And we think there's a chance to capitalize on that and make sure that there's a broad understanding of what health, well-being, and universal health coverage refer to. And we think that has to be inclusive of tobacco control. Next one, please. And if we look specifically at some of the trends of the way things are sort of quietly or obviously developing, and opportunities to advance tobacco control. So first one is just a few blocks away here in Geneva at the WTO, the push by some countries, especially some middle income countries, for a waiver to essentially pause intellectual property rights when they relate to diagnostics, vaccines, and medicines for COVID. This is a relatively groundbreaking push. There hasn't been something like this broadly supported in recent years. And this opens up the question is, should governments be granting monopoly rights also to industries, whether it's for copyright or other economic advantages, if they harm people's health, if they harm the population's health. We have the evidence now to quantify that harm. And if we're using intellectual property law and trade agreements to advance health, should we also be looking at how we govern tobacco control in this sphere? The next one is what I just mentioned also on a strong push with health moving up the agenda, a strong push now for universal health coverage. We can see the benefits in countries that have given affordable healthcare and access to different types of healthcare for all their citizens. Tobacco control needs to be recognized as an integral part of that UHC package. It's not just about doctors and medicines and hospitals. It's also about exposure to secondhand smoke. It's also about prevention measures. And we need to keep that long view of UHC. And the last one is really just the prominence of the way that health ministries have been included in planning discussions, just whether it's the G7 discussions, G20, or even within each country's cabinet, the seat at the table for the health representatives has gotten a little bit more prominent, and we need to use that access and those voices to strengthen the convening power of tobacco control in these. Next one, please. And Adriana in her opening remarks referred also to the environmental costs from tobacco, and it's something that has been building prominence the same way health has over recent years, but it makes sense for us to link the two. And the way we can link environmental justice and tobacco control, one example, next slide please. We've worked with the FCTC Secretariat and some other partners, I think it was Tobacco Free Portfolios and American Cancer Society, maybe some people who've worked with us on this or on the webinar now, but essentially to design a tobacco control social impact bond, a pay for performance scheme to find the farmers who want to switch from growing tobacco, who find that it's not profitable, that it harms their health, that it's holding them down, that these contracts are exploitative that they sign, to find the ones who want to trade and give them the resources needed to transition into a different livelihood, whether it's growing different crops or whether it's having a new livelihood altogether. We've quantified what the cost of helping that transition along would be. And everything we've done in the feasibility study so far indicates that it is a good deal for the farmers and for anyone who invests in helping finance that transition. So we have, for this initiative, it's still in progress, but we have identified impact investors, and now we're looking still to find the right outcome funder. But it's one thing to keep an eye on that we hope will come together in the coming months. Next one, please. Now, the movements for social justice sort of concomitant with the COVID events last year, a huge rise in prominence of anti-racist and other social justice activism and causes. And each of these would benefit by having tobacco control, if not central, at least included in the efforts. Next slide, please. And this could be not just in racial and economic and environmental terms, but also in terms of LGBT rights. And we can see an example here of marketing specifically targeted at those communities, and there are other examples as well. Gender justice, gender rights, also really key part of tobacco control efforts for really decades. And then also just to plug a really good piece by the Stop campaign that came out a week or two ago, a retrospective on the long history of racism and big tobacco that's worth looking into. But really getting our voices into all these other things, not for tobacco, not for the sake of tobacco control on its own, but to strengthen these other movements, really will help give legs and sustainability to the tobacco control movement. Next slide, please. That's it for me, thanks, and I'm happy to take any questions later. Back to you, colleagues.
Thank you very much, Dudley. Very good presentation. Now let me introduce Mrs. Kelsey Romeo Stapi. I hope you're hearing me well. Yes. She has been working on global tobacco control since 2013. As managing attorney, Kelsey leads action on smoking and health programs on human rights and criminal law. Kelsey has received commendation for her legal research, writing, and advocacy. She has published numerous articles on both tobacco industry criminal liability and tobacco and human rights, including an article in the American Bar Association's International Law News on tobacco and human rights in Latin America. The article was chosen by another ABA publication, GP Solo Magazine, to be included in the best of the ABA feature issue. Kelsey will today present practical application of human rights to tobacco control. Please, Kelsey, the floor is yours.
Hello, everybody. Good morning, good afternoon. I hope you can hear me. Someone let me know if there's a problem. So I'm Kelsey Romeo Stapi, and I wanted to talk today about, yes, if we agree tobacco is a human rights issue, what do we do about it? So we get started here. First, human rights, what's the argument that tobacco control is a human rights issue, and what rights are we talking about? This is a very simplified version, but the most relevant rights are right to life and right to health. Governments have a duty to enforce those rights for all of their citizens. So we're talking about the government, not about the corporation at this point. Governments therefore have the duty to protect their citizens from the tobacco industry and the harms caused by tobacco. And legal remedies are available if they don't, at the international, regional, and national levels. This is another way of explaining it. The Ruggy principles are used in international law: protect, respect, and remedy. Governments are required to protect their citizens from the tobacco industry. The industry is required to respect human rights norms. And when those things don't happen, there is a right to remedy. So there's mechanisms and processes in international law to have recourse when the industry infringes on those rights. I wanted to talk a little bit about the intersection, which I think Dudley just did so well. But I think often tobacco control and health issues are siloed, and more we need to talk about them outside of those silos. I think COVID has been just an amazing example of that. I'm going to talk later in my presentation about menthol in the United States and racial issues there. But so COVID-19 has negatively impacted African Americans much more than other groups in the United States, as does menthol. And we really need to be making these connections. You know, tobacco, human rights, social justice, and the SDGs and COVID, so they all go together. And I think we really need to be highlighting how fixing one or improving one will help improve others. I wanted to talk a little bit about social justice and human rights and the difference. In the United States, I think social justice has almost become synonymous with human rights, and while they're similar, they're not exactly the same thing. I think as an American, human rights are it's not a very popular thing to talk about in the US. So I think social justice has become sort of the buzzword when we actually mean human rights. So to advance social justice, we need to remove barriers that people face because of gender, age, race, ethnicity, religion, etc. Human rights are rights that are inherent to all of us, regardless of all of those things. So obviously they're very interrelated, but we work towards social justice by upholding human rights. And tobacco is a barrier to that. I also wanted to point out that it's really essential to remember that human rights are indivisible and interdependent. So in the race social justice example, if a group is being marginalized because of race, it's going to impact many rights. It's going to impact right to health, socioeconomic rights, environmental rights. All of the things are connected. So how do we use human rights to advance public health? One thing that ASH is trying to do is to work towards a COP decision clarifying the role between human rights and the FCTC, that the FCTC is intended to be based on human rights principles. And we think that will help us in the international mechanisms to have more proof that this is a human rights issue and international human rights bodies should pay attention. We can use the COP decision and other arguments for advocacy in litigation, in domestic litigation, in international litigation. We can also use it in reporting. I'm going to give an example in a minute, but ASH has been really involved lately in reporting to human rights bodies, including the Human Rights Council, and encouraging them to take action on tobacco control within their mandate. I've mentioned race a lot, but women's rights, the Convention on the Elimination of Discrimination Against Women, it's well within their jurisdiction to take action on tobacco issues that impact women or girls. So we encourage them to do that with reporting. And I will talk a little bit about it later, but if you're interested in becoming involved in that, please feel free to reach out to me. Wanted to give an example of a success story of how this actually works. Argentina was up for country review before the Convention on the Elimination of Discrimination Against Women. Every country that's party to a treaty comes up for review about every 5 years. It depends a little bit on the treaty body and if the government actually submitted their report. So it varies a little bit, but a group of tobacco control advocates submitted a parallel report to the government report. And the result was that the Committee on the Elimination of Discrimination Against Women, the group that hears these reports, came back to the government of Argentina and urged them to ratify the Framework Convention on Tobacco Control. So that was an incredibly strong outcome from a parallel report by a tobacco control advocate. I also wanted to give another real life example of how all of this is coming together, and this is all through work ASH has been doing. And as a side note, that bottom Newport advertisement was actually mailed to me personally at my house about 1.5 years ago, which was pretty entertaining. But the real life example is that the ASH and several of our partners, including the African American Tobacco Control Leadership Council, are currently suing the FDA for their inaction on menthol. The FDA, I'm sorry, is the Food and Drug Administration in the United States. So we're currently involved in a lawsuit suing them, asking them to please, please, please take action on menthol on the grounds largely that it has had a negative impact on the African American community. We are also involved in advocating to the International Convention on the Elimination of All Forms of Racial Discrimination. The United States is party to hardly any international treaties, but that is one that we actually are. So we're going up through the domestic courts, trying to get the FDA to make changes. At the same time, we're working in the international system, encouraging that body to ask the US government to take action. So it's sort of all coming together. Hopefully the end result will be a ban on menthol cigarettes in the United States. I went through all of this very quickly, and it's complicated to talk about all the things that we can do because there are so many. But ASH has been building a hub for a couple of years now where we try to make it a one-stop shop for anyone who's interested in tobacco or human rights or the overlap. We have a lot of examples of the reports I've been talking about, the submissions we've been doing lately. So please feel free to take a look there. We also recently incorporated with the Human Rights Tobacco Control Network. So we're now running that out of ASH, if you were familiar with that organization in the past. So that is based on this site as well. And that's here as well. We have another group that's specific for action alerts, so you can sign up for that as well. We're frequently calling for sign-ons from the tobacco control community for submissions, like a letter to the Office of the High Commissioner on Human Rights on development, COVID, and tobacco. Or we have submitted to the UN discussing rights of people of African diaspora, talking about menthol in the United States. So we frequently do these. We have, I think, already done 6 this year. So please, if you're interested, join up and we will keep you posted. Thank you so much, and I'd be happy to answer any questions when it's time. Thanks for having me.
Thank you very much, Kelsey. Another very good presentation, really. So now it's the time that we can begin to answer the questions that you have submitted to the panelists. And I have here already one question from Dudley that came from Laurent Hubert. The question said, I fully agree with the proposed opportunities under COVID-19, monopoly rights, UAHC, and convening power in coordination mechanism. But what about also supporting the Article 2.1 of the FCTC, which call on parties to go beyond the current article of the Convention to protect the right to health? A number of countries like Australia, France, are doing well with the FCTC implementation, but we are still unable to lower prevalence level to the adequate level to protect health. So that is the question for Dudley.
Thanks, Laurent. Really helpful question. I think for us, when we're looking, globally and trying to cover as many countries as we can, as a first stop, we just want to get people to the recommended levels of implementation, but obviously massive benefits to overshooting it. And I think it'd be helpful also if we, while urging them to get to that level, also kept in mind examples like the ones you cite where countries have gone further and use that as examples of what they should be aiming for. It'd be great to with you and other colleagues to do a little research and look into, what happens if you get to the recommended levels and how much more could be gained by overshooting and going further as advised by that Article 2.1. So really helpful question and good point that we shouldn't limit ourselves to the bare minimum. Thanks.
Thank you, Dudley. We are waiting for the questions to be sent to us. So perhaps I can ask to Kelsey if she can have her impression on how much countries are using Article 19 of the FCTC. As a head of the convention, obviously, I'm very interested in listening that point, Kelsey.
Sure. So I didn't mention Article 19 a lot in my presentation, but we do a lot of work on that as well. I think that a lot of countries are using it without knowing that they're using it or saying that they're using it. For example, in the United States, there's been civil litigation against the tobacco industry for decades now. But I don't think very many practitioners in the United States would say they're using Article 19. I am particularly interested in the criminal side of Article 19. There was a case in the Netherlands that I'm sure many of you know about that was charging the tobacco industry with manslaughter. And I think this is a really exciting way forward for Article 19. I also think there's so much overlap between human rights and Article 19, and that we need to keep that in mind as well. It would be perfectly reasonable for there to be a challenge in domestic court on violation of human rights and the tobacco industry. So I think particularly any country that has the right to health ratified in their constitution, which is so many of them, would be really ripe for a challenge like that. So I think that's an interesting way forward as well.
Thank you very much, Kelsey. And since I have you on the microphone, I have another question that I can address to you. The question came from Ragna Pandey, and they ask, is there any law to protect right of health of those exposed to tobacco smoke as passive smokers?
Sure. So that gets a little bit more complicated with secondhand smoke or passive smoke because there's another actor involved. It's not just the government, but I think a really great example of that would be government failure to protect people from passive smoke at work. So if you had smoking in a restaurant and you were a waiter or waitress and had ill health effects from that, I think that would be a perfect example of how the government failed to protect your right to health by failing to implement smoke-free workplaces.
Thank you very much, Kelsey. I have one question that I think I can send to Dudley. The question came from Henok Solomon, and it's about teen tobacco smoking. He said that teen tobacco smoking is becoming a major concern in low-income countries like Ethiopia. And what is the proposed strategy to reduce incidence of teen smoking?
Really, really good question. And when we do the analyses of the cost of tobacco, it's the preventing young people from starting is the best way to get the most bang for the buck, essentially. In terms of how specifically to prevent teens from starting, the normal FCTC demand reduction measures are all effective there. One I look to particularly is the tax and fiscal measures. Young people tend to have less income to spend on discretionary items and tend to be more responsive to increases in prices. So that's particularly one where we can try to reduce teen use. Another one is just ensuring that there's a ban on sales to minors enforced, in place and enforced. Thanks.
Thank you, Dudley. If I can add my piece, I usually say that change the environment, change the norm is very important. While teens begin to see that really this is not something, first of all, that is not cool, and for that we need to really control the marketing of the tobacco industry, and that is not something normal because it's not allowed everywhere, and that I'm talking about the smoke-free environments. I think that these two measures together with the other two that Dudley mentioned can help to put something that will help the teens to quit, not to begin, sorry. I have another question here that I think it will be also for Dudley. It came from, I'm sorry for the mispronouncement of the name for sure, is Vasant Kumar Maisoremath from India, and ask, when tobacco producing countries who are signatories to FCTC, including minister, prime minister, or parliamentaries, are encouraging tobacco farming through subsidies, support price, easy loans, procuring illegally grown tobacco for auction, how can we achieve justice in health?
Really, really strong question. I think the general approach is, if the first thing you do is do no harm. So if you're in a hole, stop digging. The last thing a government wants to do is use its resources to get further in the hole in terms of the health and economic losses from tobacco control. With the FCTC Secretariat and WHO, we do work to make sure that there's coherence and policy coherence among governments and different ministries when setting policies, not just tobacco control policy, but farm subsidy policies, trade policies, all these other ones. So again, it's that two-way approach. Make sure that you have a strong tobacco control mechanism, policy coordination, everything in place, but make sure also that other parts of the government and other policies are tobacco sensitive and tobacco control informed. And that's one thing we can work on in a situation like this, is making sure that the decision-making bodies who set who gets subsidies and who doesn't are informed of the harm of tobacco, both economic and health from that. Thanks.
Thank you, Dudley. I have now another question that I will take myself because it's about FCTC, and it asks, how can FCTC parties be encouraged to promote human rights and justice at the upcoming FCTC COP9? Well, in this part, I will say two things. One, as I think Kelsey mentioned, there is a proposal from a couple of countries to present a decision on human rights to the COP. So that is one thing that you can do, because when you have a decision, theoretically the decisions are adopted by consensus in the COP, and therefore they are let's say binding for all the parties. But I think that also there is work that can be done at country level, and I think civil society is very important, of course, because as Kelsey showed, sometimes the shadow report, let's say the report that have been done to the human rights bodies by the civil society had ended in recommendation of that bodies to the country. We had that story of Argentina, we have another one from Brazil. So it's very important that we have these kind of things. And also for people that work, for example, in the tobacco units, in the ministries, that you can try to contact your peers that are, let's say, in the ones who are the focal point for the human rights bodies, and ask them also to work in their own constituencies, because we need also to have the other way. We need to have the people from human rights looking at tobacco as an issue that belongs to them also. It's not only that human rights is something that we need to approach. I think for their own benefit, they need to approach the tobacco control movements in order to advance this common agenda. So I think this is a two-way road that we can have. Now I have another question that is from Laurent. Laurent, you are sending a lot of questions. It's for Kelsey this time. Is what first step should tobacco control advocates on the ground take? Most of us do not know how to start using human rights mechanisms. What should be the first steps?
So thank you for that. I think that it is overwhelming. You know, it's a big system. There's a lot of different entry points, but I think there are both policy and communications entry points at the national, regional, and international level. So recently we had a training for California advocates on using the Convention on the Elimination of Racial Discrimination to talk about local menthol bans. So I think one thing we can do at the local level is encourage people to start thinking of this in terms of human rights language. I think when you're going to a local council member and saying, I believe this is a human rights violation, I think their ears perk up. You know, talking about a menthol ban is not maybe the most exciting, but as a human rights violation, I think they're going to be more engaged and interested. At the international level, I would say the easiest way to get involved is to start by working on a country report. And we would be happy to provide technical assistance for anyone interested. Because there's so many human rights bodies, there are a lot of opportunities to report, and we can focus the report for your country on what's coming up next. So Convention on the Rights of the Child, women's rights, anything like that.
Thank you very much, Kelsey. I have another question now for Dudley, came in from Ann Jones. She asked, is UNDP or other global partners able to offer support to other countries to develop investment cases?
Good question. Of course, we definitely want to do more. Through the FCTC 2030 project, over the last few years, we've been able to do 24 of these national investment cases. They're an offshoot of other ones we're doing on non-communicable diseases more broadly. And with the UN NCD task force, WHO and other partners, we've done maybe 30 of those. And they branch off again, NCDs, tobacco control, and then we're starting also mental health and pollution. But essentially, we've got a running list of expressions of demand from governments requesting the support, and we try to take that list and match it up with donors to support us getting into the countries and doing them. But we're always happy to do more if we can. Thanks.
Thank you, Dudley. And just only to illustrate, because I don't know if everyone knows what is the FCTC 2030, that is a project that is funded by the government of UK and also now by Australia and Norway that support low and middle income countries and is led by the Convention Secretariat in conjunction with the UNDP and WHO. So if you are a low and middle income country, be attentive if any call for proposal for FCTC 2030 may appear in at some point, okay? Well, I have another question, and I think this will be for Kelsey. And the question came from Judith McKay, and she asked, what would your approach be for a country like China that interprets human rights in the context of lifting populations out of poverty, rather more so than freedom of speech, but also a massive state tobacco monopoly?
So I think China is a very interesting example because of the state tobacco monopoly. I think they're a fantastic example for a human rights court. I think a challenge coming out of China could go to the International Court of Justice. That said, we're not in a vacuum, and there are a lot of other human rights issues that need to be dealt with in China. So I'm not sure that this would get as much attention as it could. One other thing that we have been considering a lot in our human rights work is that this is an opportunity for countries who don't necessarily have the best human rights record to do something really positive for human rights that doesn't cost them too much. So if, for example, some EMRO countries wanted to take a stand on tobacco as a human rights issue, they could really improve their human rights records through something that is just a positive experience for them. So we try to present it that way often when talking to people in countries that don't have the best human rights record, including my own sometimes. So certainly not putting that on any other country.
Thank you very much, Kelsey. Another question for you. Tobacco death should be considered as murder. Is it possible to successfully litigate the tobacco industry at the International Criminal Court for causing 8 million deaths globally every year? And as this is even more than the number of Jews killed in the Holocaust?
Absolutely, and this is a little bit of a pet project of mine. I studied the International Criminal Court a lot in law school. I think absolutely, the tobacco industry has committed, their crime is crimes against humanity. I think in definition, they absolutely have. To get into the International Criminal Court, we need to have some failed cases around the world first, so we can show that the International Criminal Court needs to take action. So the case in the Netherlands that I mentioned that was involved with criminal law, that's a first step towards getting into the International Criminal Court. So it is part of the long-term plan. I think that having some Western countries is actually really helpful because the International Criminal Court has often been viewed as a way for the West to sort of demonize the rest of the world. So I think bringing in some Western countries and tobacco executives might actually be a way for us to get in to the International Criminal Court. So yes, and I hope that will happen. Stay tuned for 5 to 10 years.
Thank you very much. Really an interesting perspective. Another question, and this one I will take it, is from Gracie Grillo and ask, Article 18 seems to focus on tobacco cultivation and manufacture. So when discussing environmental justice, should we include and discuss tobacco If you have seen in the European Union has been passed a directive now that will oblige the tobacco products, the cigarettes, specifically to have a warning that they contain plastics. So I think this is one of the first measures that I have seen, at least that I have knowledge of, on begin to addressing the part of the waste of the tobacco. Of course, the tobacco industry is saying that they are trying to solve this problem, but the fact is the filters are one-use plastics, and these need to be reduced and or banned. So that measure from the European Union is something that I think if other countries could replicate will be very interesting. From the Secretariat, we are trying to begin to work together with the UNEP and inside WHO with the Department of Environmental Health, just trying to address this part of tobacco that it has not been too much in the focus now, but since the environment is a problem from everyone, if we want to have some place for our kids and grandkids to live, I think that this is something that we should keep on working and trying to expand and to let's say, as the protocol say, intermingle with the other constituencies of these groups in order to show them how we can contribute also from the part of the convention of the tobacco control. Let me see if I have here another question for Kelsey. Achieng Otieno from Kenya is asking, from Kenya Tobacco Control Alliance, is asking, are there any successful cases against the industry?
Yes, a lot of civil cases against the industry. We have yet to have a successful criminal case. I want to just take 1 second and clarify what I mean. A criminal case would result in jail time or some kind of punishment for the tobacco industry. A civil case is going to result in a fine. So we use different words in different parts of the world. There are numerous examples of civil cases, particularly coming out of the US, but in lots of countries around the world. A criminal case, the Netherlands was rejected by the Superior Court, and it wasn't rejected on the law, it was rejected and sent to the legislature. So they were saying, this isn't an issue for the courts. If you want to solve this problem, go through Parliament, essentially. And there is a case still pending in France on criminal charges, and we are working on other cases around the world. But so far, no, we have not had a successful one. But I'd love to help make it happen. So if you're interested, let me know.
Sorry, I thought I would have unmuted me, but not. I'm saying that is very good that she's so eager to help with these issues. We would need to begin to wrap up, but I would like to know if my colleagues from the union do have some other questions that you want to pass in a couple of minutes left that we have, because I don't see any more questions here. Okay, let me see. Yes, for Kelsey, the Wanda D, a person called Wanda D, it says that the Dutch court refer us to the government because it is a legal product. So this will be at some time the next step. That was
Hi,
the person
Wanda.
was Wanda the Canter.
Yes, Wanda's the person to talk to about the Dutch case if anyone has any more questions. But there was an issue in the Netherlands about whether the tobacco products fell under the regulations legally or not. In some criminal cases, we have not focused on whether the product is legal, and in that case, it did. But if anyone is interested in more about the Dutch case, Wanda de Canter is absolutely the person to talk to.
Perfect. Thank you very much, Kelsey. So here, okay, this will be the last question. The question is UNDP responsible to supervise FCTC law enforcement? In Bangladesh, we need more more third-party involvement, especially regular monitoring near hospital health facilities. Well, sorry, Dudley, but I need to answer the first part of the question. No, UNDP is not responsible, and neither us as the convention secretariat. Really, the countries are sovereign, and it's expected that they are in charge of enforce their own legislation. That is why the name of the convention itself is a framework. It's the Framework Convention. That means that all the countries need to enact, implement, and enforce their own legislation. This is totally inside the sovereignty of each countries. But in any case, we can help, and UNDP and WHO, all the partners in implementing the FCTC, we can help the countries and help, for example, the health authority on how to, for example, enforce the legislation, on how to help them, put them in countries with other similar countries that have similar legislation that are being enforced in the country. But no, there is like not an enforcement power. One thing that has been discussed at the last scope was about monitoring mechanism by peers. But this is something that we pilot in the Secretariat, and is going to be presented to the next COP for decision of the parties if they then really want this reviewing implementation mechanism to be in place or not. Okay, but so far there is not a supervision of the implementation. So, well, thank you very much for all the questions. Really, they were very interesting, and I think that we cover a lot of topics that it shows very clear how inextricably linked is tobacco and tobacco control with these issues of human rights, of justice, social justice, economic justice, the environment, and how we can have some remedies, using the word that the lawyers use, when these issues are not taken into account. And I think that Kelsey shows a very good example on how to remedy this. So thank you very much, both you, Dudley and Kelsey. Your presentation were really, really good. Thank you very much for all the people who made the questions. And I give back the floor to Joanna from the union.
Thank you all for attending today's webinar. Thank you for our facilitator, Dr. Adriana, and our panelists. This webinar was organized by the Union and the 18th World Conference on Tobacco or Health Scientific and Track Committees. At the end of the session, you will receive a survey. Please don't hesitate to complete it because your feedback is important to us. The recording of this webinar will be available on the Union and the WCTOH YouTube channels. Registrants will receive an email with the link to access the recording. The 52nd Union World Conference on Lung Health is now accepting submission to the conference program. Submissions on issues including tuberculosis and TB co-infections, tobacco control, lung health and air pollution, as well as civil society initiatives, human rights, and other related topics are welcome. The deadline to submit is Tuesday, 4th of May. This year's Union World Conference will be taking place virtually from the 19th till the 22nd of October and will focus on the theme, Lung Health for All, Solutions for a New Era. Also, we are now only a few weeks away from the Leadership Summit on Tobacco Control, our virtual event that will take place on the 6th and the 7th of May. Register now to benefit from the early rate that will be going until March 22nd. For more information about the WCTOH and the Leadership Summit on Tobacco Control activities, don't forget to visit our website, wctoh.org. Thank you very much for your time.